Nearly 2 million brain cells die each minute a stroke goes untreated, leading to the increase of permanent brain damage, disability, and perhaps even death. Here at MemorialCare in Long Beach, the medical center, they have set up at the Comprehensive Stroke Center a dedicated stroke room in order to decrease the time in which a patient can be seen and treated. I'm here with Program Director of the Comprehensive Stroke Center, Angie West. How are you today?
Well, I'm working really hard today, thank you. I'm doing well.
We've been hearing that you've been rushing around today. You had a stroke patient come in earlier on. This is the dedicated room for the stroke patients. Walk us through as to what has happened.
Well, as soon as the patient comes in, they come straight to this room. We switch gurneys and we weigh them and we start doing a very rapid assessment. There's a clock above my head, up on the wall. We try and turn that clock on and get us back out of this room into CT scan within 6 minutes. So our goal is to get a quick assessment, figure out what the appropriate treatment for the patient is, and then get them to CAT scan so we can get imaging that'll then help us decide what kind of interventions we can do.
Explain to us, how does this room actually work? How has this been really beneficial for both neurologists, yourself, your entire team, and patients?
Well, we put it in this, we have everything in this room always ready for the stroke patient, so we're not running in different directions trying to pick things up. We have a video monitor over here where the physicians can dial in and they can see the patient on their phone, whether they're in their office or at home in the middle of the night, so they have that rapid eyes-on assessment. We have documentation right here. We have some point-of-care testing that we can do very quickly to get some lab results. Like I said, we have the clock to try and keep us moving. Everything is here that we need, and we all show up and do what we need to do to get the patient as quickly off to whatever interventions they're able to have.
And you did mention the stroke cart that you utilize, which is a very unique technology or a piece. Tell us, how does that actually work? How can a doctor actually tell what kind of a stroke a patient has? Because there are different types as well, and how fast can they get them over here? Like, what is the procedure there?
Well, the doctor gets called when the patient, we actually get notified before the patient even gets to the hospital. Our EMS out in the field, our paramedics are trained to identify stroke, and they will call in and let us know that there's a stroke patient coming, so our team starts preparing at that time. The doctor gets notified. I have phones and pagers in my pocket, so everybody gets notified. Radiology, lab, several different physicians, everything goes out, the page and the phone calls go out. So then the doctor knows the patients are going to arrive here very quickly, and he can get on he's either got a laptop or an iPad, or even their iPhone can do it now, where you can dial right into this cart, and his face will come up on the screen. He can see the patient and we can see him.
What are some of the symptoms?
Think fast, B fast for stroke. So B is for balance. If you have a stroke in your cerebellum, you'll be off balance and dizzy. E is for eyes. If you have double vision or blurred vision, it could be a stroke. F, facial droop is a weakness on one side or the other of your face. Your smile's crooked. A is for arm or leg weakness or numbness on one side of the body or the other. S is for speech, either difficulty speaking or understanding speech. And T is for time. Again, time is brain. Please call 911 and get to us as quickly as possible.
Incredible job that you're doing, Angie West. Thank you so much for your time and for speaking with us here.
Thank you.
Thank you. I'm here with emergency physician Dr. Burden. How are you today?
Great. How are you doing?
Very well, thank you. You've obviously had a patient here earlier on today. Talk to us a little bit about what is a stroke exactly and what types are there?
Stroke, I guess the easiest way to explain it is there's an interruption to blood flow to part of the brain, and there's basically two types of stroke. One is it can be thought of as interruption of blood flow from a thrombus or a tightening of the blood vessels that feed that part of the brain. Mm-hmm. And then the other type of stroke is a type of stroke where there's hemorrhage in the brain, actual bleeding in the brain. And obviously the two different stroke types are treated completely differently.
Okay. Vali, what are some of the challenges that you encounter for people that are suffering a stroke? What should people really know?
Well, I would tell people that strokes, there's a spectrum of stroke. There's very small strokes that might have minimal symptoms, just like a little bit of numbness. And then there's massive strokes that can make someone, so that they can never walk again or, even die, obviously. So there's a large range of strokes. I think one of the challenges we have is a lot of other milder conditions mimic stroke. And one of the hardest things for us is to determine very rapidly whether or not this is actually a stroke or if something else is going on with the patient. Mm-hmm. Sometimes it can seem like a stroke, but it's actually a different problem altogether. That's probably the hardest part in the emergency room, is determining, is this truly a stroke? And should we be treating it like a stroke, or is this another condition that's mimicking a stroke?
Interesting. Well, thank you so much, Dr. Verdon.
Thank you.
Thanks for all the work that you're doing. So as you've heard, with this telemedicine device, the stroke cart, that is also dealt with the in-house neurologists and physicians to be able to deal with patients directly in a dedicated stroke room, effectively and efficiently deals with the patients to rapidly assess if they're going through a stroke, be able to treat them properly, therefore potentially saving millions of brain cells as well as the quality life of the patient. I'm Yasmin Tanrez with Long Beach Local News. For more local news, head on over to longbeachlocalnews.com.